We were expecting and he said he's on the way, but I think I'm going to start because all of you have been waiting. And so a very, very warm good evening to everyone who is here. And I really want to thank you for being here, knowing that the jobs conference is also on today. This is our first CME of ZIVIA IVF. And thanks, Mark, for organizing this for us. Just in terms of introducing first, I want to tell you a little bit story. एक थोड़ी सी कहानी सुनाना चाहूंगी कि ZIVIA कैसे पैदा हुआ. ये भी एक हमारा बच्चा है और ये कैसे पैदा हुआ. तो ये स्टोरी चालू होती है 8 साल पहले, जब मेरी एक बहुत क्लोज रिलेटिव बॉम्बे में बहुत स्ट्रगल कर रही थी बच्चे के लिए. और वो बॉम्बे में सब बेस्ट IVF स्पेशलिस्ट के पास गई, जिसमें सब बड़े बड़े नाम इंक्लूडेड हैं, और 3 बार उनका फेल हो गया जो भी वो कर रहे थे. उस समय मुझे IVF के बारे में कोई नॉलेज नहीं थी. मैं एम्बुलेंस चलाती हूँ एक्चुअली. तो उन्होंने मुझे, इतना डिप्रेशन में चली गई थी, तो उन्होंने मुझे बोला कि तुम गूगल पे सर्च करो कि मुझे कौन सबसे बेस्ट कौन है इंडिया में और मैं उनके पास जाना चाहती हूँ. तो ऐसे तो प्लीज, तो मैंने गूगल पे सर्च किया और आई फाउंड मैम, बिकॉज ऑब्वियसली बॉम्बे में तो हम धक्के खा ही चुके थे सब जगह. तो मैंने कहा ये आनंद तो अमूल के लिए जाना जाता है, तो मुझे ये पता नहीं. और सब सर्चेस में इनका ही नाम आ रहा था. तो फिर मैंने देखा BBC में भी इनका इंटरव्यू है, ओपरा विंफ्री में भी इंटरव्यू है इनका, CNN में भी इंटरव्यू है. सो आई सेड, ओ माय गॉड, शी मस्ट बी अ बिग पर्सनालिटी. सो देन आई सेंट हर अ मेल. So abhi obviously now our doctors are so busy, nobody reports to me. Instantly I got a reply कि आप आ जाइए. And we went to आनंद. जब आनंद गए तो मुझे लगा छोटा सा शहर होगा, जयपुर से भी छोटा है. और वहां गए तो मैं एकदम, मतलब I was surprised to no limit. वहां पे इतनी कंट्रीज से लोग आ रहे थे और इतनी छोटी जगह में इतना बड़ा सेटअप मैम ने कर रखा था. और इतने लोगों, मतलब वहां पे ऐसे लाइन लग रखी थी लोगों की. और हम मैम से मिले और एक ट्राई में चमत्कार हो गया और उनको बच्चों की खुशी मिली. ये 8 साल पहले की बात है. उसके बाद मेरी फैमिली में पता नहीं कितने लोग हैं जो इनके पास गए हैं. आपको मालूम है ये चीज ऐसी है कि लोग बताते भी नहीं है, पर गए हैं, उनसे खुशियां उनसे मिली है. और मैम से मेरा ऐसा मिलना होता रहा. और फिर हमारा एक क्लिनिक है दुबई में भी, और मैम को वहाँ पे मैंने इनवाइट किया एज अ विजिटिंग कंसल्टेंट. तो मैम ने एक्सप्रेस किया कि आई वांट टू स्टार्ट अ चेन ऑफ क्लिनिक्स एंड आई वांट टू लीव माय लेगेसी. सो लीव माय लेगेसी, वो जो वर्ड है ना, दैट अट्रैक्टेड मी. क्योंकि एक डॉक्टर जिसने इतना एक्सपीरियंस पाया है, इतना नॉलेज पाया है, जब वो डॉक्टर नहीं है तो फिर वो काम कौन करेगा. तो शी हैज टू मेक hundreds of Nayana Patel so that her legacy can be. So then ma'am is very focused towards her medical work. She said, business mein mere ko kuch malum nahi hai, so I need somebody to help. So we got together and we have 2-3 people who helped in getting this whole concept together, ZIVIA IVF. So ZIVIA IVF is a chain of IVF clinics across India. And ये ZIVIA जो नाम है ना, ये मैम ने दिया है. इसका नाम means Lord of Life and Fertility. It is such a beautiful name. Actually मुझे ऐसा लगा इनका ब्रांड जो पहले थे आकांक्षा है. मुझे आकांक्षा नाम बहुत अच्छा लगता था, पर जब भी हम ZIVIA बोलते हैं तो ऐसा लगता है जीने की इच्छा होने लग जाती है. तो उसी तरह ZIVIA आया और मई में हमारी बात हुई थी. और फिर कोरोना का टाइम चल रहा था और मेरा मन था कि मैं बॉम्बे में सेटल हूँ, तो बॉम्बे में चालू करें सेंटर सबसे पहले. और मैं ओरिजिनली बिलोंग करती हूँ ब्यावर से. और कोरोना के टाइम में मैं अपनी मम्मी के घर चली गई थी और मम्मी और मेरा भाई यार पीछे पड़ गए, जयपुर में चालू करूँ. तो मैंने मैम से पूछा, मैम जयपुर में चालू कर सकते हैं क्या. मैम कहती है जयपुर से इतने पेशेंट्स आते हैं So I don't mind. So I said, okay, let's start both Jaipur and Bombay. And as luck would have it, जयपुर का प्रॉपर्टी पहले फाइनलाइज हुआ, जयपुर की डॉक्टर चांदानी आलूवालिया में पहले मिली और जयपुर का बर्थ पहले हो गया. So this is the Divya story in short. So the reason I'm telling you is we are not here. I mean, of course, money is a byproduct of whatever you do, but I am at least associated with MAM because I really want to do good work, and I want to make sure we do ethical work and we bring, happiness to families, and that is the only reason we are associated. So with that, I'll just give. I've already spoken a lot, so I won't take too much time. This is about us and. Give happiness to everyone. That is our thing. Ethical and transparent is something which I have to tell you. She is very black and white. अगर कोई patient आता है और उसका hope मतलब कुछ hope ही नहीं है, then she will say it's a waste. और अगर hope है, then she will try. And a lot of IVF clinics, and after my relative went through what she did, cycle पे cycle, and it's just a money-making institute. So I think that is something which we will not. By us, I think you must please, I request all the doctors to come and see our center. We put a lot of love and affection in building it. And it's in C scheme above Starbucks. So the location cannot be better. And, so please do come and see. It's a very comfortable and a nice center. We do all kind of, treatments, and ma'am will talk, so I will not spend too much time, and a lot of advanced services which she has launched, and I think ma'am you should talk more about it. A team of experts, so Dr. Nayana Patel has personally trained each and every staff, has gone to Anand and stayed for 6 months and got trained and come back. So we have everybody who's trained at her institute and will be able to soon deliver the quality she delivers, and she's committed to being here every month to make sure everything is going as per the protocols. I don't know if I should really read this slide because, but I think I should, because one thing I realized is going to Gujarat and in West Bombay, people really know her, but Jaipur में मुझे ऐसा लगा जब हम लोग मिल रहे हैं तो डॉक्टर के बारे में कुछ ज़्यादा knowledge नहीं है. So I think she's of course very bright, 5-time gold medalist. Her education is brilliant. 30 years in this, in this service, and delivered 18,000 babies. I think her award list, ये तो है ना इतना ही आया presentation में, तो मुझे 5-6 slide और लगानी पड़ती. But she's been awarded or recognized by our Prime Minister, Mr. Modi, when he was the CM of Gujarat. The list is very, very long. And I think to be featured on Oprah Winfrey, BBC, CNN, Times, I mean, you name any international journal and she's there. And I think that talks a lot about her quality of work. And she's got a very good team, of course. एक डॉक्टर अकेला ज़्यादा नहीं कर सकते, इनकी टीम बहुत अच्छी है. डॉक्टर हर्षा, she is one of the top 4 embryologists in India, and she is just amazing. She was here yesterday because we are right now doing in batches, and she is doing all the embryology work, and she is as committed, dedicated like ma'am. And Dr. Nikhil Patel, Dr. Malina Patel, who now are ready to take ma'am's footsteps. And Dr. Paresh Kumar, and here we have our own Dr. Richa Nani Aluwalia, gold medalist from S.M.S, young but dynamic, and Dr. Renu Sharma, who of course has been in IVF for the last 8 years. So our motto is, whenever a person comes and if they choose hope, anything is possible with that. Just some glimpses. We have clinic में तो ये CME कर नहीं पाते थे. So ये हमारा clinic है. This is our reception. These are our doctor counseling session rooms. This is our counseling room. If husband wife wants to discuss, admin area, USG room, laparoscopic OT, IVF OT. The lab is state of the art. You cannot get better equipment. Ma'am has got, I don't know, German equipments and all those equipments. And I'm like, ma'am, ये सस्ते नहीं मिल सकते क्या? She doesn't compromise. semen collection room and the recovery room. And this is our pharmacy. We have an enhanced pharmacy as well. So that's about ZIVIA from my side. And I also wanted to invite, I have a patient here, actually, Rashi, and I want to invite her because she's from Jaipur and she went to the Gujarat, and I will not say much. I will let her speak. Over to you, Rashi.
Hello everyone.
Rashi. Yeah. You can come here. You can. She has to be there.
मेरी स्टोरी भी वैसी है जैसे मैंने स्टार्ट किया कि उनके कोई रिलेटिव जिसका 3 टाइम आईवीएफ फेलियर था, तो मेरा 5 टाइम आईवीएफ फेलियर था। मैंने जयपुर से ट्राई किया था 5 टाइम, और उसके बाद गूगल में सर्च करके
एक्चुअली हम लोग 5 टाइम्स आईवीएफ ट्राई किया था हम लोग ने, और वो अनसक्सेसफुल रहा था। तो काफ़ी होपलेस हो चुके थे हम लोग। फिर कोविड के बाद हमें लगा एक बार सरोगेसी ट्राई करना चाहिए। तो मेरे फ्रेंड ने गूगल पे सर्च किया था, जैसे मैंने बताया, तो गूगल पे एक ही नाम बार बार ट्राई कर रहा था। उसने काफ़ी R&D वगैरह किया, तो उसको लगा कि एक बार तुम वहाँ जाके ट्राई करो। तो हम लोग मैडम के पास सरोगेसी के हिसाब से गए थे, बट तो मैडम ने जिस तरीके से राशि को चेक किया और वो सब किया, तो उन्होंने बताया कि आपके लिए अभी होप है, एक बार आईवीएफ आप ट्राई करो। बहुत पॉजिटिव तरीके से मैडम ने समझाया। हम लोगों ने डिस्कस किया, क्योंकि ये 6 टाइम करना हमारे लिए थोड़ा सा मुश्किल था, लेकिन फिर जिस तरीके से मैडम ने समझाया, वहाँ पॉजिटिव वाइब राशि को भी आई, तो टोटली डिसीजन राशि का ही था। तो हम लोगों ने फिर उसको ट्राई किया और सक्सेसफुल रहा। नाउ वी आर हैप्पी।
हमने स्कूल में चल रहा था, होटल में क्योंकि घर बहुत दूर है, तो आना जाना लगे रहते हैं। तो अभी मैम का जैसे ही कॉल आया, तो मैंने कहा मेरे को मैम से मिलना ही मिलना है।
प्लान कर रहे थे कि वहाँ आने जाएंगे मैडम के पास, बट फॉर्चुनेटली मैडम यहाँ आ गई। तो
So from surrogacy to having her own child to IVF, I think if she had to make money, she would have just suggested surrogacy, right?
absolutely.
Yeah. So, thank you for that, Rashi. I really appreciate you coming here. I know you have to feed your kids, so please go. And thank you for being here. All right. So with that, I think I will move ahead, and we are still waiting for a few more people, but I think we will move ahead. We would now actually invite Dr. Richa Aluwalia to be on the diet, and Dr. Nayana Patel and Priyash Mangal to make this dream come true.
इधर भूल है वो
Okay, so before I hand over for the topic of today to Matt, I just want to also introduce the people on the back. So Dr. Nayana Patel I have introduced. Dr. Anani Aluwalia has been trained under Dr. Nayana Patel, and all the cases are taken care by her. The protocols are same as what doctor follows, and they are constantly discussing about each case. I'm happy to share that we already done 15 cycles. We opened on 15th Feb, and we've already done 15 cycles. Last 2 days also we did, and we have now 4 transfers tomorrow. So we've taken on a good start, and we really need all your blessings to serve people and treat people like Rashi who have really given up hope in life. And Yash, of course, is a business person. And when he heard that Dr. Nayana Patel wanted to do this, and he said, I'm going to make sure that this is the best clinic in Jaipur. And whatever you saw of the clinic, thanks to him, that he stood in the Corona time at the side and got Dr. Renu, of course, and Sukhman. These are 2 of my right and left hands. So she manages the entire clinic, and Sukhman and Ramesh, of course, they are in the field, meeting all doctors like you and introducing Dr. Nayana Patel to all of you. So thank you all, and Ayush, of course, is a pharmacist. So thank you all for being here. And with that, I'll request ma'am to talk about when you should refer a patient to our clinic. Ma'am, I can take a presentation. You can stand here and speak. Okay.
Good evening, everybody. First of all, I would like to thank you all for taking out this time and coming over here. I know most of you know when to refer a patient, but importantly, meeting with people, we know that a patient of infertility does not need a medical specialist. They need their family doctor, family physician, their gynecologist for the hand holding, doing for the treatment. If we advise that you need IVF, they will not believe. But if you advise that they come to you, that this is the time you go for IVF, don't waste your time, they immediately come. Because I was delivered by that doctor. I have been going, my whole family has been going to that doctor. And she is the gynecologist for our family. So unless you get the patient, they will not go ahead with the treatment. And that is the reason why we are here today. So evaluation of infertile couples and when to refer them to the clinic. This is a very important stage in an infertile couple's life. There are some couples who do a lot of Google and see that IVF is the first thing to do. Some couples who really need IVF, but they feel that no, they are scared, it must be painful, it must be very costly, it gives all negative results only because they have heard so many negatives around them. Or some complications like twins, preterm delivery. So they are really scared. And this is the time when if a family physician, a family gynecologist guides them to really go ahead only. So in brief, we know that Brown, who is now 43 years old, and she herself is naturally conceived and delivered a baby, and the IVF procedure. Here again, the family physician or the gynecologist is very, very important to us because we don't want the patient for the first 10 days to come to our clinic. They can go to the nearby clinic, take their injections when they are doing their IVF. We give them the supply of injection. We call up the gynecologist and say that you can do this. Just send for the scan, or even you can do the scan and get the ZIVIA associated private practitioner who can do the sonography. Just give us the report and say, okay, these are the findings. What should we continue and tell them that we give this injection. So the patients who come around from say 50 kilometers, 100 kilometers would not have to walk in every day to Jaipur or ZIVIA. They can get all the treatment online, and then just come for the retrieval to our center. So here also the role of obstetrician gynecologist is very, very important for us. If you look at the indications, we know mainly it started with the blocked tubes, but now the main indication is male infertility. Severe male infertility is so much on rise, and I see that even in Rajasthan, like in Gujarat, the tobacco, TV, alcohol, whatever it is, the male infertility is definitely on rise, and that is becoming. You see, young girl, 24-year-old, married for 5 years, and the husband count is 2 million, 3 million. Poor girl, she's undergoing the injections to meet that time. But here it is important that if the male factor is severe, or if it's borderline and you have tried for 2 years, it's better to refer them earlier than later, because the fertility potential of young egg will compensate for the subfertility of the sperm. And if the same female reports at 32 years or 33 years, her success would be lower compared to if she comes at straight away 26 years when she knows that the count is just 4 million, 5 million, 8 million. Let them go for 1 or 2 years of treatment, Ayurveda, allopathy, whatever they want. But after that, if we guide them that because the wife is young, your eggs will be better, the outcome will be better, it will compensate for your poor sperm, they will immediately decide. We know that endometriosis nowadays, even in our patients a lot. Severe endometriosis, people definitely need IVF. Yes, I know there are couples where IVF fails and that they conceive naturally or even they can IVF. At least one trial of IVF will give us a lot of egg. What is the quality of the egg, or whether the embryo really is a good quality embryo, or the uterine receptivity and then issue. And definitely nowadays we do a lot of IVF for PGTM, sickle cell, thalassemia, minor, major. Actually, matching for thalassemia, major and sickle cell is also, and my embryologist is very well trained in embryo biopsy. So that facility we can now offer even in Jaipur. Taking embryo biopsy for PGTM, PGTA, finding out even HLA match when the probes are ready, because for that we need the blood of the couple, blood of the existing sibling who is sickle cell or thalassemia major patient, and even sometimes buckle swab we need. If the blood transfusion has been done recently in the baby who is a thalassemia major, we need the buckle swab. But if we prepare this probe, we can do that. So what I say is, it is very imperative that the basic infertility work of treatment starts with the routine gynecologist, but at the same time, a timely referral to the specialist care is very important. Sometimes we go with the flow. The patient wants to resist IVF, and we think that let us not push, let us try. But there comes a time when we have to tell them that you are wasting your time, you are wasting your money, and you are abusing your body with drugs by doing repeatedly IUI or routine treatment. It is better you go for IVF. Collect money for 3 months and go for IVF. That is the right treatment. So referral at the right time is very important. And we know that it takes some way, especially the age of the female. Longer the duration of infertility, even the paternal age matters for that matter. Fibroids which you have removed beautifully, and then we think let us try and again 2-3 fibroids pop up. Endometriosis comes back. Rather than that, when you have done a wonderful job laparoscopically for the endometriosis treatment, timely referral will give a higher success rather than the recurrence and the second surgery. So the right time to refer is very important, and the reduced natural conception because of the age, because of the endometriosis, or uterine problems also coming up with advanced age will reduce the success. And we know that IUI less than 25 has 27% success, but after the age of 40 it's just 8%. So female age is a very, very important criteria. And we also know that whatever treatment we do, even IVF, the success rate after the age of 40 drops to 10% or less. So this is the pregnancy rate by the age of the female. Whatever we do after the age of 40, the success rate is 10% or less. Now, evaluation, we all know that the proper history taking, all the pre-med testing, tubal testing, laparoscopy, finding out what is the problem is done by the gynecologist and obstetrician, and they can go ahead and do the treatment as long as they feel that the age of the female is too young, or there is some BMI type. Too much of underweight is also there. They are the worst patients to treat. Overweight, we all know, reduces the implantation rate. Repeated polyps, repeated infection, a baseline scan, which is very, very important to find out any uterine or ovarian pathology. Nowadays, the baseline scan starts with the abdominal scan rather than a transvaginal scan. So this is a routine now that we ask the patient first. We check the transabdominally. Sometimes you find the ovary high up, you can find a big cyst. Then you make the patient pass urine and then go for the transvaginal scan. Then the post-radical examination. So what we started with a routine transvaginal now has shifted to transabdominal, transvaginal, and post-radical to get the perfect idea about the uterus and the ovaries. Then ovulation testing, the holistic approach is what everybody can tell them. Your diet should change. You should be more on proteins and greens, less of carbs. Positive thinking, acupuncture, yoga, whatever keeps them, mentally distressed is very important. Giving up of uses like alcohol or smoking or drugs if they are doing is very important. Hysteroscopy, we know, and we always suggest any referring direct that if you want to send a patient for IVF, and if you think that she needs hysteroscopy, you do it and send it to us, so that our job is just to do an IVF, pre-IVF hysteroscopy, you can do it, do the proper job and send it to us. Laparoscopy also, we know, has a major role to play, especially when we have hydrosalpinx. We have to clip it before we do the embryo transfer. Check for all the abnormalities in the uterus, endometriosis. And nowadays, we do a lot of laparoscopy for ovarian rejuvenation. Somehow, being in a small town, when I started my IVF in Anand, a population of 150,000 at that time, that was in 1997, 1998. People were laughing that it's not successful in metros, what you will do in Anand. If I needed double distilled water, I had to run to Ahmedabad. If I needed Metrodin drug, that was the Serum Institute, Serum at that time, I had to order it from Mumbai, put a person at the railway station, somebody would carry it, bring it, because there were no dealers in Anand. But I always felt that if rich people can go to Mumbai, get it done right, what is the fault of the people who are not doing? Let us do it, Anand. We definitely got a success in 1999, and this is the story after that. So any new thing, surrogacy 2002, the legal law approved it. 2003, I started. Why not? If something is coming up, if science is advancing, we should take the initiative and do it. And fortunately for me, Anand is a place where they have a lot of exposure to the Western world. Each and every house has some energies for non-resident Gujarati. So the idea was very well accepted. Surrogates came forward, the infertile couples came forward, and the story started from there. Now we are doing a lot of regenerative medicine. Bone marrow, we don't do stem cell passage because that is not allowed in India. But the bone marrow, which we remove immediately, the concentrate is separated in hour and a half. We inject in the ovary. For thin endometrium, tuberculosis, no menstruation, only spotting at times. Number of hysteroscopies done, PRP done. These patients can develop good lining. When we take out the bone marrow derived concentrate, we take the patient in the catheter. I have a catheter in my hospital only, ground floor. We take there, in the femoral artery, we pass the catheter, go to the opposite iliac artery, go to the uterine artery, and with microangio catheters, we push that 1 to 1.5 ml of bone marrow concentrate into the spiral arterioles of the endometrium. At the basal layer, there is some endometrium remaining, which gets the blood supply and it starts going. And from the second femoral artery, we do on the opposite side, rest for a night, and then patient goes back from wherever she is. And then they start developing that menstrual flow increases to red blood flow for 2 to 3 days instead of just brownish discharge. We have given up on this tuberculosis, S.M.S syndrome, repeated. These patients themselves conceive and we have already 5 delivered 6 ongoing pregnancy out of 12 patients that we have treated. This article is already in the two international journals we have published. So that also we started. PRP we started. Biopsy and an in-house NGS platform. We analyze our own embryos there. So the new technology, right now we have done a study on microbiome, gut microbiome and vaginal microbiome in repeated implantation failure of recurrent miscarriages. And we have found that, and that is also now published in one journal. So that research also took us 2 years. 10 patients controlled, 10 with recurrent implantation failure, and 10, I would say, unexplained infertility. Recurrent implantation had 2 miscarriages. And we found out that which is the bacteria which is affecting and how we can use probiotics and prebiotics for this patient. So definitely a test will come up and then the treatment protocol will come up. So anything new, we are always excited. Embryo transfer, routinely transabdominal sonography could be employed. Since last 3 months, we have started transvaginal sonography and looking the embryo. Myself, I do the sonography and I myself can keep the embryo inside. Patient does not have to keep the bladder full. Obese patients, retroverted, stuck uterus, very beautifully transvaginal ultrasound guided, we can do embryo transfer. So in short, what I feel to say, what I want to say is that we are very open to the new ideas that come. Sometimes we burn our fingers, we won't succeed. So 10 projects we start, maybe 5 we don't succeed, but 5 we do like this. Also, there is people who feel that there is increased risk of miscarriage, but that is because of the fertility of the infertility issues of the patient, advanced age, etc. Male also is a precipitating factor. All the time we say that the count and motility is normal, so it's fine. But paternal age has definitely an impact on the IVF outcome, and also under some genetic malformations or some autism is also associated with advanced paternal age. DFI, we started routinely doing it all our patients. We never stamp it as normal unless we get a DFI report. Then many genetic tests that we do, karyotyping in your 4 cycles or initially only. So whenever we do ovarian rejuvenation, we always do karyotyping in young patients to rule out any genetic, especially fragile X is also one for the family. We check the volume of the ovary, it should be good for the stem cell or the PRP to work, and we rule out autoimmune disease in these patients or any medical condition. We have started our IVF cycle in last batch with 3 cases of GSA. This is for me, I'm here to do GSA. So the American guideline for referral is that the level 3 ART clinic, the woman is more than 35 years of age, and for 6 months she has tried and she has not conceived, or they have said 18 months, but very young patients we can give 5 years. Like if they get married at 21, 26, everything is normal, it is unexplained. No need to bring it after 5 years, it is best they go for IVF. So level 3 care, we have all the facilities of the ART, the whenever the endocrinology support, etc., the male infertility support, andrology, everything we have. Certain patients who have severe pelvic pain, abnormal results from pelvic examination, like the position of the uterus is not proper of the ovary, or male has severe varicocele and that is treated, is not giving outcome when it's treated to the. So this is very, very important. The patient is in the middle, the fertility specialist is there. So the journey for an IVF patient will start from the OB/GYN and then come to the anterior phase. And that is the reason that if the OB/GYN is constantly in touch with the anterior referral, I would say the reverse. The ART should be constantly in touch with the OB/GYN so that we get the timely referral, we get the patient we refer it back to them for further individual care and treatment for which they are master. So this I would like to say that management of infertility, dosing, etc. everybody does it. But to summarize, the potential sequences of the delay or later referral to the reproductive endocrinologist or infertility specialist will hamper the outcome of the patient in childbirth. So it is better to refer within 1 year of infertility. I would say 18 months if the is less than 35 or 6 months if more than 35. Nowadays, multiple techniques have come up and we feel that Or we can ultimately say like today I had two patients who walked in simultaneously. One patient I said definitely help you consider into IVF. The second patient came with her, I said, don't think of IVF, your uterus needs removal, go visit someone because a huge animal. She started crying. She had failed cycles. I said, it's not going to help you. Even if you cry, we cannot do anything about this. All you need is if you cannot do something, structure. But otherwise, this don't waste your time, money going to clinic up from one thing to another. That idea is going to help you. No idea is going to help you. So once again, thank you all from ZIVIA once again, and we definitely need all your support. We are there to get any time that we have a patient needs other help. Thank you.
So thank you, ma'am. I'm not a doctor, but I still understood whatever she said. So with that, I also again want to extend a lot of people have joined us today, and I really want to thank you for your time. I now want to introduce Dr. Richa and ask her to come and speak about the procedures that we at the idea, and especially about the new procedure we're doing.
हेलो एवरीवन जैसे मैम ने बोला है यहाँ पे थोड़े से नॉन मेडिकल्स भी है तो इसलिए थोड़ी सी सिंपल लैंग्वेज में समझाना चाहूंगी कि न्यू प्रोसीजर्स कौन से हैं जैसे बेसिकली आपने सुना होगा कि पीआरपी प्रोसीजर बहुत आजकल इन फैशन है पायलटेशन होता है जिसमें एक्ट्रेसेस कराते हैं खुद का ही ब्लड लेके स्किन में इंजेक्ट करते हैं जिनको बालनेस होती है तो वो हेयर ग्रोथ के लिए स्टार्ट बेसिकली सब अपने ब्लड में वाइट ब्लड रेड ब्लड सेल्स होते हैं वाइट ब्लड सेल्स एंड प्लेटलेट्स जो प्लेटलेट्स होते हैं उसमें ग्रोथ फैक्टर्स होते हैं तो वो आप बॉडी के कोई भी टिश्यू में इंजेक्ट करो तो अच्छे से वो टिश्यू ग्रो होने लगता है तो वही पीआरपी हम लोग देते हैं जैसे पेशेंट का ही ब्लड देते हैं उसको ओवरीज में इंजेक्ट करते हैं ट्रांसवेजाइनल सोनोग्राफी के थ्रू या फिर हिस्ट्रोस्कोपी के थ्रू एंडोमेट्रियम जो बच्चेदानी के अंदर की परत है सो इट ग्रोज बेटर ये टेक्निक आई डोंट थिंक जयपुर में कोई कर रहा है अभी मैम ने इंट्रोड्यूस किया these are the new techniques that we are working and for male infertility there is microfluidics उसमें basically जिनकी sperm quantity ठीक होती है but we have a doubt with the quality तो microfluidics है DNA fragmentation tests है ये सारी services हैं ये भी exclusively ZIVIA में होगी thank you
Thank you, Richa. She's a gold medalist from S.M.S. So young, pretty, so but she's so dynamic in her work. It's amazing. Thank you, Dr. Richa, for being a part of the community. And before we break for dinner, any questions anybody has for ma'am? Or over dinner we can discuss one-on-one. I think that's better. I want to just take this opportunity also to facilitate a few people who have been instrumental in making ZIVIA live in Jaipur. And the people are here, so ma'am, can you please come here, please? And so we have, you know, for this one clinic, we have 11 licenses. And you know, when it comes to government, how things work. And actually, nothing else troubles me more than that. And so the team here is there, Mr. Jerry, Mr. Michael, and Susan. So I would like to facilitate you on behalf of ZIVIA IVF for really helping us with the toughest job of licensing. So thank you. Thank you. And we actually invited our inferior person also. I think he will make it, and Dr. Sudhir Bhandari is on the way. He will join us for dinner. So with that, let's break for dinner and have a good day. Thank you very much, all of you. For today.
इससे पूछता हूँ बंद कर देंगे। हेलो हाँ हो गया